Hi. So, thank you so much for the introduction. Today, we are here to discuss how public private partnerships between governments and various healthcare systems can fruitfully add value in building networks of healthcare outcomes that can actually benefit people at large. So, I actually wanted to broaden the discussion a little bit to not just PPP as a structure, but any different ways that industry can associate with the government networks. And for that, I actually wanted to throw a question to Sunilji first. So, what are the key advantages of such partnerships, be it PPP or otherwise, in enhancing delivery systems, especially in a country like India?
See, advantages of this PPP models are many. They're manifold, but I would just like to highlight a few important advantages. The first thing is the private setups. They have the expertise of running the hospitals and managing operations, and their expertise can be valued. Right? This is one of the important advantage which we have. And secondly, I would say that affordability. Of course, the public-private partnership, they run on high volume and low margins. So ultimate aim is to provide universal health coverage to the masses. So affordability is an important advantage which we have, which has been always been a challenge, which is an important element, essential element of the universal health coverage. Then talking of the accessibility. So there is more accessibility through the private partnership to the masses in the rural areas, especially with the, if I can say, the even telemedicine, of course, and use of technology. And of course, efficiency is an important factor. The quality of care, efficiency, affordability, availability, acceptability, and of course, most importantly, the availability of the specialist. This is an important advantage because you see most of the healthcare, primary healthcare centers, they are short of doctors, and we know that 62% of the healthcare in our country is provided by the private players, and but 80% of the doctors in the country, they are in the private sector. So that expertise and the specialist care, what I would say, can these all factors. I think they are the great advantage to have this public-private partnership. Yeah, thank you.
Do any one of you want to add anything to it? So, as in, what are the key advantages of partnering with the government network?
So, as Sir also very rightly highlighted, the accessibility factor is one thing that in the rural setup, as we know, still the healthcare from the government side or the private side is not up to the mark to reach all the tribal populations of the country. So, if there is a synergy between the government and the private setup, this unmet need can be met for, because as we all know that it's 70% of the healthcare setup is in urban areas, while our 70% of the population actually is residing in the rural areas. So this disconnect can be solved by the PPP model. Obviously, adding to all the points Sir said.
Yeah. Do you want to add anything?
Yeah, but if I may request you to repeat your question because I could not hear.
I'm so sorry. I hope you guys heard it though. So, what are the key advantages, right? Like, there are challenges to working with government systems. We all know that. We'll dig into that in a bit as well. But let us first look at the positives, right? Government is one of the biggest stakeholders in, because we are talking about healthcare today, but in most other systems as well, but in the healthcare ecosystem in India specifically, because of one of the things that you mentioned, that we have a huge rural landscape even today, and the delivery systems are not adequately built up. So, what are the advantages of any partnership or any structure of partnership of the private sector with the government sector?
Yeah. Thank you so much, Doc. Definitely, if you look at currently Indian healthcare system, it's a private economy. That's a fact. And we don't have a choice right now because we are at such a junction wherein we need to pull out best from both the side. Both side have his own advantage and the best way to get into a PPP model. If you want to reach to the last post, if you look at the last post in any of the remotest place, the government has a reach. The government would have a last public, like primary health center. Private sector won't have. Government would have its own disadvantages, but private sector could get into it and put it to the advantage, like my colleague said, that the concentration of the doctors or the skilled resources are with the private sector. But infrastructure, to a greater extent, to remotest places. In the morning, we heard, some of the presentations from the government executives, also an administrator. The remotest to remotest places, the infrastructure is created by government. So I think so. Both coming together is going to build up a huge synergy, and that's how we can make the current buzz what we are talking all across the affordability and accessibility to some extent feasible. So I think so it's very, very important, and there are merits on both the side, as you rightly said. Rather than looking at the demerits, they are there. The only way to go ahead and look at the future is how we can make things better. So one idea to make things better certainly is having PPP model, and it is fairly possible in current capacity, both party coming together. If the intent is there, then I think so. We are a country which is leading in many ways. There are many things which can be worked out. I think so. That's the first thing. Coming together is the beginning, and we have a long way, and we can do many things.
That is true. So now that we have established that partnering with government networks is going to be key for certain outcomes, specifically the 3A outcomes, right? Affordability, accuracy, and access. So when we are focusing on these things, let us now dig into what are the success stories, right? Not just in India, but across the globe. Both PPP and other business partnership models have done phenomenally well. At least some of them have been groundbreakingly so. So why don't you guys, who have been veterans in the industry and in healthcare systems, give us a couple of examples?
So one of the biggest example of PPP that we can tell is the Ayushman Pradhan Mantri Yojana that we have in our country that we call as PMJ Yojana. Largely, I would say that empaneling about 28 to 29,000 odd hospitals in the country and getting more than 23 to 24 crore beneficiaries under the net. I would say that this is one of the largest PPP program that the government has undertaken. And along with this, the reach of the rural population to healthcare has definitely increased. We all know there are some demerits and disadvantages to the schemes as well that definitely has to be addressed to have a wider net and quality healthcare institution getting into place. But still, I would consider that as a good start from the government that they have included private into the machinery that common man also can access to all the private facilities. So it's a stepping, I would say the first step or the second step for the Yojana. Lot many things needs to be done. But yeah, one of the success story can be considered this. Otherwise, sir also can elaborate on that.
Thank you. See, as he rightly mentioned, the first, most important, and the first example which he has mentioned over the AB, Ayushman Bharat Prime Minister Jan Arogya Yojana. I think ABPMJ is a huge program, and it's a flagship program along with the ABDM, launched in 2018, and covering about 50 crores of population who are vulnerable, economically vulnerable India, I should say, and more than 40% of the country's population, covered by this yojana or this program, I should say. So I think this is something which has actually, increased the reach and benefited, the masses. So one is to classify. One is the central government schemes, and other ones are the state government schemes. Among the central government schemes, there are many other. There's a Bima Yojana and some, which are for 18 to 70 years old age. And then there another insurance scheme for till 59 years of age, 18 to 59 years of age. I think these are the central government schemes. And then there are various states which have, their own schemes. We all know about the Karnataka Yashaswini scheme. We know about Maharashtra and other states. And even the NHM, under the NHM, there are, different PPP models which are actually very successful. And PPP in primary, management of primary healthcare, PPP in management of emergency healthcare, PPP in the management of emergency, and then your diagnostics, PPP in the clinical areas, your dialysis care, and PPP in even non-clinical areas. You have, management of non-clinical areas, like you have biomedical waste management, which is outsourced to the private agency by the government, and also in biomedical equipment maintenance. So, if you see, it covers the entire gamut of healthcare, from prevention, preventive, promotive, curative, rehabilitative, and palliative care. So entire gamut of the as elements of healthcare is covered. So there are various central government and state government successful models. I think there are many, but of course very few we could only discuss here. Yeah, if you can add something.
Yeah, I mean, I would take from where you stop,
Sure.
Doc. Both my colleagues, panelists have spoken that. PPP model is in India. It's working for last couple of decades. If I put it, we look at the financing, we look at designing, we look at developing, we look at operating, and we look at maintaining. And PPP model is working in all these areas. Like we spoke about Pradhan Mantri Jan Arogya Yojana, and like that there are many examples which basically talk about the financing, and which has come as a big boon. And it is working very well. It has some of its own lacunae, and the way how I've been studying it ever since it has been launched nationally, and prior to that it was available at a state-wise in a different forms, in a different name. Like if you go deep down south, you'll get it in a name of Atal Bihari Vajpayee Yojana. Maharashtra it was Jivandai. Today we are calling it, initially it was Rajiv Gandhi, now it was Jivandai. Somewhere it is Deen Dayal Yojana, and now we are looking at a global, which is as a national scheme, and we are talking at, Pradhan Mantri Jan Arogya Yojana. So that's as far as financing is concerned. In financing also, there has been a really very success models. This is definitely a success story, and we all have witnessed it, more to do with the COVID. But prior to that also, there were really some, the state level collaborations which were happening, and people are working. I don't know how many of you are aware. If you go to deep down south, Dr. Devi Shetty is called as a Henry Ford of, cardiac surgeries. So he was able to generate so much of volume, and with the government of Karnataka, they came together with a middle and lower middle class income, and they started an insurance bima scheme, wherein I may not be able to give you the exact number, but roughly like family of 4 could pay from a rural area 300 rupees, and from a family of 4 in urban area would pay 700 rupees, and you would get covered for 1,45,000 rupees surgical work. And now it has been adopted at various places, and it has worked wonderfully. Same way, if you look at the another part, is from an emergency management point of view. 108 was a super hit model, and it is still working very well, roughly around 7 to 8 states, when we call it as emergency management and research. So what they do is, they pick up the patient, they stabilize the patient there, they give they evacuate the patient, they look after the patient there and there, and they transfer the patient to the higher center wherever it is possible. So that has been a successful model. My colleague panelist also spoke about diagnostic. There has been successful model in diagnostics. Like Karuna was the scheme, I think so, which got good response in Northeast states. They did there very well. So like this in India, we have n numbers of examples which have done very well in pre-digital era. So I think so getting digitalized and getting medtech is going to be icing on a cake, because there has been a successful model which has worked very well. There are reasons why it has not well. I have just given you a few examples which you count on your finger, which has worked very well. But if you really get into a deep study, we will have n numbers of cases which have actually gone to disaster. But that will give us a really good experience. So today we are sitting with the 2 decades of experience as a country wherein we know what has gone very well, and there are tons of examples which tell us what has not gone very well. So that's a learning which is immediately there for us. So that's where I'm very, very hopeful with medtech, with digitalization, and with the rich experience. We just can accelerate now, because technology is something, healthcare is something which is sold very well for last 2 years. If you look at your IRDA also, if you look at the insurance has gone way very high. What they could not achieve in 10 years, they have achieved in 2 years by getting their premiums. So everyone is very much aware of it. There's an infrastructure, there's an intent to work on it, and there are a lot of success stories which are around us in PPP model. And more than that, there are a lot of unsuccessful stories which are there to guide us. So this is what I thought should be a way ahead for us.
No, certainly. I think, Vinod, though, there are a couple of things that I'll contest on you with. That, you know, in terms of PPP, guiding success and failure is generally not as simple as that in an outcome generated or a revenue generated model. So, that being said, I think not just in India, if you look at globally, there is a structure of three systems which have benefited very well across PPP, concising the discussion across all three of my esteemed panelists. One is in finance sectors and insurances, right? So if you look at Singapore's, the Singapore's model or the PFI model in UK, Singapore's 3M model, all of these have been extremely successful insurance schemes that have worked very well, connecting the public and the government systems. Public and the private systems. So has systems in Canada, which has now been the WOH system, the William Oslo systems, or in South Africa. So these some of these have been very well accepted. Second is the infrastructure. So a lot of, in fact, in India, a lot of good hospitals are still PPP hospitals. These are teaching hospitals. These are great hospitals. And as much as our excellent private sector has succeeded, a lot of the doctors have come from these PPP models and these hospitals that have garnered excellence not only in patient care but also health education. So that is the second. And the third is logistics and supply chains. So from research in the pharma space all the way, and life sciences, all the way to, the Genome Valley and other initiatives that we can see right now in Telangana or others that we are seeing in Noida as well. So I think not just in India, across the globe, these are the three areas that, at least in my understanding, PPPs have succeeded very well. Though one thing that I would really like to take from what you said as well is that we really need to learn from where we have failed as well, because that's going to be a gold mine of information that's going to help us move ahead. Now that we have established without a shred of doubt this important to go ahead in this direction, let us dig into how, both from a tech as well as a non-tech front, to what are the problems that we require to solve through these models, and how do we go about doing that, both from a private as well as a public perspective. So, how do we go about establishing the PPP models, and for which problems, both from a tech and a non-tech perspective?
See, there are different models of PPP. We all know. I think I need not elaborate. Just to name a few. We have franchising, contracting in, contracting out, vouchering. So there are so many, different models adopted by the different agencies. I mean, the private sectors. I think it is very important that before we enter into any collaboration or partnership, see, partnership can be with for-profit organization, or can be with for non-profit organization. And of course, this partnership, first of all, most important element is the trust. The trust is very important. And when you enter into any agreement or any memorandum of understanding, you need to clearly define the roles of each stakeholder. Sometimes there are multiple stakeholders involved in these partnerships. So I think defining the role of each stakeholder is important. And then most important thing is there problems come when there are a lot of regulatory frameworks, when it comes under a lot of regulatory framework, which actually is a big hindrance for a successful PPP model. I think what she asked was about the tech and non-tech. I think I would first describe about the tech. Technology, of course, is playing a major role. Technology has a great role to play in accessibility, affordability, and the digital transformation. I think it is an era of digital transformation. We are talking of digital health, and ABDM is one very good example, which definitely increases the efficiency, effectiveness, and also transparency. It benefits all the stakeholders, ABDM, all the physicians, patients, the providers, and the government. I think all stakeholders are benefited. And I think that's it. Yeah.
So for the tech part, I would take that as the two things which have been done significantly in the western part, that is in the state of Gujarat and Rajasthan, and must be for the other states as well. The e-Sanjeevani OPD that the government has launched, or the telemedicine program, whereby all the rural patients can take the service of this e-Sanjeevani and get consultations of specialists and super specialists on a large scale. And the next is the e-ICU concept. So government of Gujarat now has given ICU beds of remote districts and the remote hospitals to private players. And the private players are managing the entire show via the central console that they have, the command room that they have established in cities like Ahmedabad, Baroda. And all these beds in the rural areas are being managed. Now, due to these cases of poisoning, snake bites, the mortality associated with all those kinds of illness, these are being addressed right at the initial level without getting the patient shifted to another higher center, and we are able to reduce the mortality to a large scale. So, tech definitely has a large role to play in this, and with coming times, at least post COVID, we all know the importance of intensive care units now. But as a country, we are dead short of all the critical care specialists, nursing and paramedics. So this is the way forward of enabling tech and going to all the remote parts of the country. Along with that, the non-tech part, definitely human resource building is a major thing, along with all the things that we have talked previously as well. So government medical colleges are also there, but now the district hospitals are getting converted into medical colleges via PPP model, so that we are now able to have more medical seats. Along with the same model, the nursing and the paramedics has to be developed, and more such programs where we strengthen our human resources as a whole of the country. Such systems has to be developed via the PPP model, along with definitely the infrastructure thing and the things that we have talked previously.
If you look at the deeper challenges of PPP, I would say, it's easy to say PPP, but, getting those both be together and making partnership is very difficult. Now I'll talk somebody who's coming from a private side. So number one is both see the same thing in a different way. Like somebody is there only for a service, and for private to invest, he or she, whatever, what they are going to get in the return. So I think so that also need to be clearly established. Many a time that is not very well established. So that's one of the big reason. And all my colleagues who operate the hospitals, they would understand what is the problem and what I meant by that. Second thing is there's always a challenge with funds allocation. I'm happy that it is becoming better. I can say that, CGHS system in recent past has been extremely good since last 1 year. And then every time we see a notification coming in every 3 months or 6 months, which is helping all the private colleagues where the most of the healthcare is, kind of a motivation for them. So that piece also need to be developed, because otherwise your DSO, your TAT goes to around 1 year, and sometime when you get after end of the 1 year with a lot of deduction, That's the biggest demotivation. Because you pay your people with a very high rate of interest. And what money you get money at a 30% discount. So nobody wants to put their hands over there. People would like to put their finger where the pulse is and not at a different places. Third challenge, which I see, is the administration. The state administration is still very, very difficult. It's still debatable whether it's a central subject or it's a state subject. We all know what subject it is. But then, like beyond certain level, if you go, it's a passing on the hat. You go from one place to another place. So I think so this model, and wherever this model has been very, very successful, are the places where the administration has been very strong. Above that is the governance. So I think this is a bit of a problem at a governance level also. How we are going to do and what we are going to do, which goes, beyond the state administration. So these are the actual broader problems when it comes to making PPP successful. These are the challenges. Of course, there are other challenges. There are other challenges of a healthcare which is applicable for public also and for a private also. Because as a public, our focus has been always mother and child. Like family welfare. Vaccinations, infectious diseases. Like malnutrition. But today we are talking about malnutrition. We are talking about the lifestyle oriented diseases and series of diseases. That's where all of a sudden we want the investment to come. That's altogether a separate piece. But I think so these are the four major challenges. One is the administration, second is the governance, third is incentivizing people, and fourth is incentivizing people on a right time. So if this can be addressed, we are part of the same geography. We are happy to support whatever support one could extend. But when you don't get this support from the other end, on which you rely completely, then it becomes a very, very disappointing. So if these four things are taken care, I think so there's a way to go for everyone.
No, very well said. I think I agree completely with you. Being a hospital and being not able to get the working capital necessary in a structured timeline is a big problem. And I think now that insurances are mandated to pay out in 21 days, why not government insurance systems as well for adoption? And I think CGHS, even AHS schemes have done decently well, and
Yes.
PMJ has improved upon it, surely. But I think one of the major things is that apart from tech in strategic healthcare spaces, the tech revolution going along with every other system, the payment systems, the digital information systems, all of that has played a crucial part in making it better, and it's still a work in progress, of course. But it's come a long way, I believe. And I completely agree that tertiary care centers and hospitals, like the ones you have led across, both of you as well, have this huge difficulty of being answerable to your stakeholders as well, not just to your employees, and looking at healthcare as a business, not just as an initiative or an outcome or a patient outcome model. So I think that is one of the crucial factors, which is why generally PPPs have worked much better when we are talking about rural systems where there is less investment in real estate, asset light model sub-centers, for example, in India, as you quite rightly mentioned, have been very, very widely spread, where no other hospital could ever sustain. So some of these models of public investment, that research in certain areas, as well as ownership of certain strategic properties, that has actually worked out very well. So we have talked about this, and I really, because healthcare is the theme of the day, I would really want you guys to give me some understanding of what are your thoughts on the current ABA program, as well as interoperability that is promoting through the ABA program.
Me?
Yeah,
Yeah.
sure.
ABBA, of course, it's as a part of the ABDM, ABBA and the physicians. I think this is very important, and it is applicable to both public and private hospitals. And we actually, as an AHPI, our organization also support these two flagship program of the government, PMJY and also this ABDM. In fact, just to brief you about the organization, we have presence in 20 states. We have about 20,000 hospitals as members, and we are the one of the largest association of private healthcare organizations. So we have tied up with the National Health Authority, and we are supporting and promoting this, ABHA and PMJ, ABDM and PMJ program. ABHA, definitely it is this. Definitely it will increase, the affordability level and also the accessibility level. And the interoperability, if you see, the patients are definitely benefited that they have their records, they can maintain their records, and everything is there, their history, their investigations, reports. They don't have to carry that thala, in physically, manually, and everything is there in the system. So, and wherever they go, so whichever hospital they go, they are, I mean, the physicians can have access to their records. So ultimately, overall, care, the patient care. See, when we every in the whole in healthcare, the focus is always on the patients. We always talk of the quality care and safe care. So this will the main beneficiary in this whole game is the patients. So definitely, ABHA has a great role to play, and I think we all should support that, and it will go a long way, yeah, in implementing this, successful PPP program.
Parth, do you want to add something?
I agree with sir on this, so nothing more to say in this. But yes, as it's a patient-centric thing, and the patient gets the entire control of their health record and data, so now it's very easy for all the patients to go for any other opinion with the doctors or with another super specialty if there is any reference. The entire data can be seen. So quality of care again will increase, and obviously the accessibility definitely will increase, and we also as a hospital support this initiative of the government.
Yes, even I'm very optimistic about the entire thing. But if you look at the ground level, see, if you look at a typical HIS system, which is Hospital Information System, which has been developed for last 2.5 decades, they are basically billing systems. The larger portion of hospital information system, 70.
And booking.
Yeah, so billing, booking. So the piece which is not available over there is your supply chain is as good as on a dormant stage. Your clinical modules are as good as on a dormant stage. Now, of course, there are many systems. Some of my colleagues also, to whom I'm going to meet tonight, I'm going to make maximum out of it coming to Delhi. They are working very well on making it, better EMR and everything. But predominantly, whatever archive we have, either they are, huge godowns, number one. Number two, if they are on a system, we don't have enough data on a system. Or we already have those systems which has maximum of billing and, the registration modules and everyone. So now, as a country, we really need to focus on standardizing our HIS. Because that's where all the data is going to picked up. I know some of the government agencies like CDAC and everyone is working on it. They are providing, I know them because they are based out of Pune. They are developing HIS for Odisha and other places.
No, I think we did an attempt with NDHM as
Yeah.
well, right? National Digital Health Mission. That was a very decent attempt, though I think that will come as a second phase to the current ABDM network that we are building on. So I believe that might soon become a reality as well.
So from, a lot of our colleague hospitals are yet to go on a EMR. And ABA is as good as EHR, it's like.
Seriously? They are still not on EMR?
Yeah, many of them, that's a reality. So, I would say at least 70% of them in a country. I'm talking about, let's move out of the metros and tier 1 cities, and there we'll have an answer that many of them are not on actual EMR. There's good HIS, you can pull in your data, and that's where we are falling short of clinical research. That's where we are falling short of clinical trials, because it's a laborer's work to go and find out and take details. Even for a doctors, if you ask them to do that, they say, should I see the patient or you give me assistance? Let them work on the biostat and all the other thing, and then I'll look at it. So I think so. I'm very optimistic about it. Nowhere I'm saying it's not going to work. It is going to work, and that's a way forward. But we should also pay attention of standardizing certain systems, bringing everyone on the same platform. So the data standardization happen, because when we create a universal ID, the whole aim of doing this, we get into AI. We are going to get all virtual reality, augmented reality. For that, I think so data standardization is important. And for standardization, I think so applications need to be very, very standard. So while I'm optimistic, there are some few questions which we need to keep in mind.
No, this is surprising that even in the private sector today, we don't have EMR portability for a ton of hospitals, though. Uh, I think it's a worthwhile problem to solve. That being said, the whole idea that we have recognized the richness of data, personal health data, and the way it's moving around in the system, and the push towards making it more and more, multipotent, more and more enhanced, and as you quite rightly said, later on going forward to build the AI systems for predictive analytics or going forward to ML systems for single structure analysis, all of that will be possible only once we are able to enhance this with clinical intelligence and clinical information, which of course we are not yet very close by. But I think it's a step in the right direction, is what I would like to say. So, concluding today's discussion, I would love for you guys to give your thoughts as to, what are your thoughts on the current PPP systems and how should we move ahead?
Yeah, I think the way forward, whenever we talk of PPP model and so the three things we have to keep in mind is the viability and sustainability, and of course, which ultimately will lead to the successful, this public-private partnership. So I think if these elements are kept in mind, and for various factors are which influence this successful PPP model, where we say as I mentioned in the beginning also, that the trust and the both the players, I mean all the stakeholders should be have more of they should be communicating to each other. There should not be any gaps, and they should take care of each other's needs and capacity building, training. So I think all these factors are important. And way forward, today when I talk of startups, I think it's also important to mention about the startups. And there are various startups which have entered into the PPP model. About 90,000 startups we have today in our country, and more than 100 incubators, I think. And there are many which are into this PPP model. So I think as uh, PM has, also we should not only involve in infrastructure part. We have various other scope in services in the scope, as she mentioned about the insurance, private insurance company. Also, we have national health programs, like we have malaria eradication 2030, TB elimination, TB elimination in 2025, and the UNICEF has set the target of 2030 for TB elimination. But against this 2030, our Prime Minister has gone ahead, and the challenge he has accepted, and he said 2025 India will eliminate TB. So again, the role of public-private partnership has a huge potential. I think it's at national level, at state level, and at international. I think there's huge potential that we can do this.
So, concluding, I would like to say that to identify the problem statement for any PPP and extensive collaboration and discussion with the stakeholders, that is public, government, and even the private players like private healthcare setup, has to be taken into confidence before modulating any scheme or anything, because what happens is the scheme is rolled out and the private then is sometimes at the mercy of the government to get involved in the PPP, and hence all those problems that my colleague also rightly mentioned of finance and etc. That comes up. So the problem statement has to be identified perfectly is one of the major things, and definitely then the implementation stage comes, and once things are definitely into motion, then I don't think so there is any challenge in having the PPP model in the healthcare things.
Yes, I agree with both. So I think so. The idea is going to be it has to be viable, it has to be reliable. If both things come, the third point will come, which is sustainable. If it is not viable, the relation is not going to be reliable, and sustenance is out of question. I think so. As a country, we have realized where the problems are. And I think so it has been put at a right track. What the problems are at a primary healthcare level, what the problems are at a district level, when we are coming up with the district hospital in every district, that's same. We are coming up with the aims in every state, that's minimum, that's also been addressed. We are doing a capacity building. We understand that we as a country have 20 medical professionals working for 10,000 people, or maybe slightly high, maybe 25, which include doctors, your pharmacist, your paramedics, everyone. So that's a number, and we understand that gap is there, and we are trying to fill up those gap. That's really nice. And by the time we do that, that's going to take a lot of time. So PPP is going to be extremely important, and I think so is going to rely on these three things. Two, I borrow from Dr. Khetarpal, which is, it has to be it has to be viable, and it has to be sustainable and reliable. Thank you.
We have learned from 40 years of experience in building PPP models like Arogya Shri, RSPY, Janani Shishu Shuraksha, JSSK, and others. And I'm sure we might be able to do much better now that we have a host of tech solutions from startups to industries being part of it. For example, one of the people here is Persistent Systems is one of the largest tech systems in the country, which initially had nothing to do with healthcare, but now they are a big part of diabetes care in the country. So I think that is one of the major roles that tech and historical advantage that we have gained from knowledge build out is going to play. And it's about segregating two things: excellence in private care. We have hospitals from Jehangir to KD to Leelavati, Max across the country, which have had excellence in private care, which are our pride and basis of medical tourism and excellence across. And then we have had medical education systems which have put us on the map in the healthcare industry, as well as in large scale insurance systems, cost reduction, supply chain innovation. So I think when we are able to, as you rightly said, Dr. Parth, identify the need of what could be solved with these solutions, quite precisely, at that point, we'll be able to design models and solutions which might be able to give a much more structured outcomes. And as you quite rightly said, collaborating with the private sector is going to be very essential. We can't let them be out of the dialogue. So, thank you so much.